Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. It's interesting how you can take something that's relatively common and really go into depth and nuance about it. So as an example, knee arthritis, incredibly common, so many patients with that. But you can take something that's really routine and take it to a personalized care to a level that you can really get into some very interesting details. So I had a patient recently who has a moderate level of osteoarthritis in her knee. She's roughly 60 years old, and we were talking about possibly using platelet-rich plasma for her knee. And so there are multiple levels to make this more personalized and appropriate for her. So in her case, we talked about using platelet-rich plasma to help improve some of the instability that she has in her knee. The idea being that can you treat the ligaments, create a little bit more tightness to the ligaments so that they have more stability, which long-term will help with her pain and function as well. Number two, understanding that given her age, using a higher dose of platelet-rich plasma would make sense rather than a moderate dose of platelet-rich plasma from an arthritis standpoint. In addition, she actually has a chronic effusion in the knee, and using something like alpha-2 macroglobulin, which has an anti-inflammatory component to it, to actually treat some of that chronic inflammation as well. And lastly, she also has some mild neuropathic symptoms as well, and so actually getting evaluated for her lower back as well. Multiple layers of subtlety to this, as opposed to just saying, let's inject your knee with platelet-rich plasma. I think that's based on an appropriate scientific background, an appropriate understanding of the clinical pathology and clinical medicine, and tailoring it to her actual condition. Thank you for your time. Live well.